Director of the Knowledge to Policy Center at the American University of Beirut, which chairs the SSG EMR network. First, let me say that I would like to welcome you to the final session of his three-part pre-conference session that we have done on building just a sustainable health system. I have to say it was a really quite enriching journey doing this type of pre-conference before the actual conference that will take place in November in Nagasaki in Japan. And I'm thrilled to see all of us here. We had a great participation engagement in the last two webinars, despite the conflicts and the challenges that are really unfolding in our region. I mean, we've seen what's going on now in Lebanon, Gaza, and others. So your commitment, I think, our commitment speaks a volume, I have to say, about the urgency and the importance of this type of work. So this is a three-part pre-conference hosted by the Health System Global Society EMR network. And it's the first of its kind dedicated in the Eastern Mediterranean region. It's organized by the Knowledge to Policy Center in partnership with WHO EMRO and in collaboration with Mohammed bin Rashid School of Government and the University of Birmingham in Dubai. The pre-conference, sought to bring different diverse set of stakeholders together to explore the different themes and sub-themes of the symposium, but mostly from an EMR perspective. So that's why the focus has been really more from the EMR perspective, reflecting and reacting on the themes and the sub-themes. So that's why you will see, as you have seen in the first plenary on October 1st, we explored the university healthcare coverage agenda, laying the groundwork for a shared vision and equitable healthcare for all. In the second plenary on October 8th, we tackled the health system resilience, focusing on how to navigate conflict, but we also spent some time discussing about climate change. These are all challenges that are too real for the Eastern Mediterranean region. And today we will arrive to our third and final plenary. This is about research, knowledge, and data for just health systems, and what do we know about innovations when it comes to methods and translation, and what are the priorities moving forward. So the key theme that will be really discussed today, before I give it to my colleague Rasha and then Arash, is that we want to discuss the rethinking evidence production and data sharing for greater impact. We want to discuss what innovations exist when it comes to knowledge translation, policy making, including the potential role of AI, and also want to discuss priorities for institutionalizing evidence-informed decision-making in the EMR. So certainly we need to take stock of all the significant progress that has been taking place in the EMR over the last several years, but also we need to address the unfinished agenda. We need to map out some of the actionable steps for the future. So let's take the next 2 hours or so, to reflect, collaborate, maybe push the boundaries of what is possible. And hopefully this plenary will be as powerful as the last two plenary that we have done. I would like to hand over now to my colleague Rasha Fadlallah, who's a board member of the SSG Society, and she's representing the EMR network. She's a health policy and system researcher and senior scientific officer at the K2P Center at UB. She'll provide us with a brief overview of the SSG and SSG EMR network, very briefly, few minutes, and also why this event would be really important this year as well in Japan. Rasha, over to you.
Thank you, Fadi, for this energizing opening, and welcome everyone to this plenary 3. So I will share my slide. And before we dive into this session, I'll just take a moment to briefly introduce the Health System Global and HSG EMR network, which is hosting this event. And I want to express my gratitude to all of you for being part of this incredible journey. So can you see the slide?
Yes, Rasha, we can see.
Okay, so HSG has been established in 2010, and it is considered the first international membership organization that is fully dedicated to promoting health system research and knowledge translation. We aim to connect and engage researchers, policymakers, practitioners, educators, and civil society members around the world to advance the field of health policy and systems research. And certainly our aim is to support health systems to attain better health equity and well-being. And the HSG builds a strong and inclusive community in all 6 WHO regions, and our membership comprises over 1,500 members in over 110 countries around the world. Our global symposia is the signature program of HSG. It is hosted every 2 years, where it brings together over 2,000 policymakers, stakeholders, founders, and practitioners from around the world, making it one of the largest symposia on health systems research. This year, as you may know, the symposium will be held in Nagasaki, Japan from 18 to 22 November 2024, under the theme of Building Just and Sustainable Health Systems, Centering People and Protecting the Planet. We also have 4 sub-themes, and if you realize, we designed our pre-conference to reflect the theme and the sub-themes of the broad event, because we wanted to bring the regional insights and perspectives to those global discussions. We want our EMR to shape this global discourse as well. And in terms of the program areas at HSG, so we offer members many opportunities to get involved and contribute to health policy and systems research, particularly through our 10 thematic working groups, which are multi-sectoral groups encompassing policymakers and researchers, as well as practitioners around thematic areas related to health policy and systems research domains. And certainly we have the 6 regional networks, of which is the Eastern Mediterranean Regional Network, which is currently hosting this pre-conference. And this EMR network has emerged because we realized that many of the challenges facing our region are health systems related, yet when we look at the field of health policy and systems research in the region, it is still undervalued, underinvested, and there is still limited capacity at both the production and the user end. So that's why, as EMR network, we want to promote the importance of and build capacity in health policy and systems research in the EMR. And we are represented by the K2P Center. So in terms of our engagement plan, we try to promote, as I mentioned, the importance of conducting and translating HPSR to inform decision and action. We try to strengthen capacity of researchers, policymakers, and stakeholders in health policy and systems research. We conduct regional meetings and webinars with partners in the region, including WHO, EMRO, around health system and HPSR. And certainly we aim to increase regional awareness and participation in HSD Global Symposium on Health Systems Research. And certainly this pre-conference today is a testament to the strength of our community, and I am proud of the stride we have made together. So this brings us to the beginning of Plenary 3, where, as Fadi mentioned, we will be tackling 3 key rounds. So in the first round, we will start with the keynote presentation by our moderator, Dr. Arash Rashidian, followed by 3 rounds of discussions with our panelists. So the first round, we will take stock of our current progress and achievement around research, data, and knowledge translation. In the second round, we will look at the unfinished agenda in building just and resilient health system with a focus on research, data, and evidence. And in the third round, we will chart the way forward by identifying key priorities and actionable steps. We will then have an open round of discussion with our audience, and finally, we will wrap up. So I'd like to take the moment to welcome Dr. Arash Rashidian, who is our keynote and moderator. And Dr. Rashidian is the Director of Science, Information and Dissemination at WHO EMRO, and he has vast experience in health system research and evidence-informed policymaking, making him the ideal person to lead today's discussion. Dr. Arash, the floor is yours.
Hello, everybody. Good morning, good afternoon. Salam alaikum, sabah al-khair, bonjour, rouz bekhair. And many thanks indeed for the introduction that we heard from Fadi and Rasha. I'm really grateful, as Rasha kindly introduced me. I'm coming from the WHO World Health Organization, and my role is as the Director of Science, Information and Dissemination, involves areas of discussion that we are having with our esteemed panelists today, which are representing the region and also globally in areas of focus. So in terms of the program, and I'm really grateful that colleagues are here. So I'm going to do my starting part in two parts. So one introduction in the context of the discussion beyond what was highlighted by Fadi and Russia. Then introducing our esteemed panelists. I want to do that now, so that to avoid introducing each one of them before they talk, so that the flow of the discussion will be done sort of more naturally. And then we go to the rounds. So probably, I mean, depending how much time we take, and our request to all the panelists, and their commitment is to remain concise in their responses. If, let's say, we could do the round three also with open discussion with the participants in the panel at the same time, so that allowing better engagement from the audience. So the two, so my first introduction is that, I'm actually connecting today from Doha, and we are here with all member states of the 22 countries of the region in Doha for the regional committee. So the annual event of the meeting of ministries of health to review the programs of WHO, identify its priorities, and decide what to do as a whole, as the region, for enhancing health in the region. This morning in particular, the focus of the discussion was on emergencies in the region. Unfortunately, there has been several emergencies over the last few years, many of them man-made, the conflicts in particular, in several countries. And right now, I mean, what we are facing in Palestine, in Gaza, in the West Bank, and also now in Lebanon is quite, I mean, devastating. I mean, the number of casualties, the people who lose their lives, and then the sort of the challenges that we all face for the health of the region. And so that was, I mean, a lot of discussion on that by the countries of the region. And what I wanted to share here, not raising that because everybody is aware of what's going on, is that I'm also impressed by the dedication of our colleagues from the American University of Beirut, from the knowledge to policy. I mean, in this difficult situation, colleagues being based in Beirut, which I mean is facing unprecedented, I mean, risk and challenges due to the bombardments, is that they are also still, I mean, the program is going, action is happening, and this is actually the testament to our role as the research and the science and data community. So whether emergency or not, we have a role for the future of the sort of better decisions for health during the emergency, after emergency, and also during the peacetime, which we hope that happens very soon for our region. So that was the sort of my first introduction I wanted to say. The second introduction is just introducing the esteemed panelists that we have here. So, I mean, if I want to give justice to introducing colleagues, it will be quite a lengthy discussion. So I'm going actually to sort of do it very quickly and with in a summary approach. So as I mean, to practice, I would start with ladies first, and then follow with the gentlemen in the group. So the first panelist I'm going to introduce is Dr. Mehnaz Kherandi. She's our regional advisor in the WHO. She's based in Cairo, in the same department that I work, and she's a regional advisor for evidence and data to policy. She's been leading that agenda in the region in the last few years, and she's I mean, MD, PhD in pharmacoeconomics and pharmaceutical management, and with a lot of experience, especially in the food and drug policy processes at national level, at the open so that colleagues can also see your face while I'm introducing. Then after
Arash, we lost you for a few seconds.
Okay,
so because it's only me, but okay, thanks.
Yeah.
Now
okay.
we hear you.
So apologies for that. So I hope it doesn't happen then. So then the second colleagues I want to introduce is Dr. Sultan Al-Sabahi. She's again a PhD in health policy, and a lot of experience in her country, Oman, within the Ministry of Health, developing the sort of the infrastructure and working with policymakers in areas of evidence-informed decision-making. But also she's involved in several global level initiatives in the generation of new methods. She works very closely with WHO at different levels, and she's been I mean, impactful colleagues for the whole WHO in the work that we do together. The third colleague, which also again works very closely with in WHO affairs, but also, I mean, she's well known in her own field in several countries, not in this region, but I mean in also in the Afro region, and the work that she does with the sort of wider community at the global level in North America and also in Europe is Dr. Nasreen Jasani. She leads the IDS's Knowledge, Impact, and Policy Cluster, being a senior researcher at the Center for Evidence-Based Healthcare at the Stellenbosch University, which I mean, sometimes, I mean, the name of the university is difficult for me. I hope I said it correctly, Nasreen. And so she also, as I mentioned, I mean, works very closely with the WHO programs and involves in the sort of development of certain tools that we do that. So now I go to other three colleagues that we have on the panel. So the gentleman, as I mentioned, I first start by Professor Ali Moqdad. I mean, he's originally is from our region. So I mean, he's from Lebanon and Yemen. I mean, sort of two dear countries of the region, but he's based at the at the University of Washington, at the IHME Institute for Health Metrics and Evaluation, leading and being the Chief Strategy Officer within the University of Washington, with role in national policies and provincial policies within the USA. He also has been leading a lot of programs related to the work of the data and processes. And also he works very closely in the relationship between IHME and WHO. So he's in a way the lead person in our interactions in the region with the IHME in terms of the program. And is joining us and while traveling as well. I follow this with Professor Shakib Najari coming. Can you hear me well, Fadi?
Thank you.
Yeah.
Yes, we can.
Oh, okay. Sure.
Yes, yes, Arash.
For a second, I thought I'm lost again. Okay.
Yeah.
So I'm glad that's not happening. So, I mean, again, I mean, a very well-known epidemiologist, a lot of experience of working within the international organization, but a key role in the sort of the Morocco national policies, especially working in areas of cancer policies and cancer plans. He's based in the sort of Fez University, but then he has also worked strongly in establishing public health practice and sort of public health schools in his country. And we had the pleasure of hosting him at the Advisory Committee for Health Research for the region in the WHO. And last but not least, I have the pleasure of introducing my old friend and colleague, Professor Ahmed Mandil, who is now joining us as the Professor of Public Health at the High Institute of Public Health of the University of Alexandria in Egypt. But then you probably all know him because of his long-standing work as the lead for research and innovation and digital health in our region for several years, as the regional advisor working in the WHO, and being also functioning as a sort of a lot of work that is happening, and he will refer to those in assessing the capacities, enhancing the capacities, including the sort of advisory committee I mentioned for health research that he acted as the secretariat of that regional advisory committee, among many other things. As I mentioned, for all colleagues that I went really briefly. I try to give justice for the wealth of knowledge that is on the panel, and I'm grateful for all your time and being with us. Okay, so I stop here with the sort of introduction. I had promised the panelists I'm not going to give a talk. I want actually to give more chance to sort of for discussion and listening to the panelists themselves when we go around the table. But I'm going to share two slides. Probably they are useful to set the scene and as we see together. So let me select the slide that I'm going to share. Hopefully it will work fine. So Kalis, can you see my slide?
Yes.
Okay. So first I start with this slide. I mean, it's a very well-known graphic. I mean, probably you may have seen this cartoon before. I start with this one because I use it also in a sort of ministerial meeting in the regional committee in 2017 in the city of Islamabad in Pakistan. The reason it was used was that we had this discussion with the ministers of health of the region, saying that whether a program for enhancing evidence-informed policymaking is needed or not. And one of the slides that was I used in my presentation was this slide. I mean, the issue of that, I mean, there are a lot of challenges in policymaking that evidence from data and research might help. But then are we really doing proper research that would help the decision making? Are they answering the questions of decision maker? And is the evidence, when it's generated in a format understandable, usable, and useful? By understandable, I'm not trivializing the understanding from the policy side. I'm saying that in a way it's being packaged in a way that is relevant to the context. I mean, it's one thing to generate scientific knowledge, is the other thing that to make that scientific knowledge applicable to the context that is serving. So, and these, I mean, sort of pipelines that are not reaching each other is a demonstration of that challenge. But then behind this is not just not being linked, it's also among the capacity for research. I mean, with my colleague Ahmed Mandil, who is with us, we did a couple of sort of detailed analysis of the sort of production of research in the region over a period of 15 years. I mean, in two separate studies with our also colleague from Jenan University in Lebanon, Professor Bazid Tadmouri. And we showed progress in research, but then we also showed that most of this research in the region on health is coming actually from few institutions. I mean, notably over a period of 15 years, about 10%, just over 10% of all publication in health in index in PubMed in our region was coming from only 3 universities. I mean, 2 universities based in Iran, 1 university based in Saudi Arabia. 3 universities together, added together would be 10%. And if we added 5 more universities, then it would be 20% of all research published from the region. In a way, the progress is happening, but still, I mean, we are not using all the potential and we are not answering all those needs. And that was a major issue. Again, with sort of, I mean, Fadi that is sort of has a key role in such programs. There was a study conducted at the regional level which assessed the sort of the mapping of institutions and programs that keep going in terms of, again, there are a lot of gaps in terms of capacities, process, etc. And there are many other, I'm referring to the work that colleagues on the panel have done, but there have been many areas showing that. So it's not just about we are not linking, but perhaps we are not doing that. And I'm sure when we listen to Ali in his remarks, the challenges on data are also massive happening, I mean, in terms of quality, process, and that's the area we work. The other slide, that's one slide. And the other slide I wanted to show to you is this slide. So I'm going to refer to a little bit of history here. I mean, this slide is coming from what a regional resolution, again, 2 years after Islamabad. So I mentioned in 2017 that slide was shown to the ministers. There was a discussion. There was massive interest in the area. They asked WHO to do more. We sat on table. We started generating processes. We would develop a technical program, which was actually conducted in the beautiful city of Beirut in February 2019 as a sort of technical discussion. Experts from the region and globally attended together. And probably that was the first time ever that, I mean, the different programs of sort of the knowledge to policy were discussed together. I mean, discussing knowledge translation processes, discussing health technology assessment progresses, guideline programs, as well as the data sources, and I mean, the issues related to ad hoc studies, all of them as the evidence that contributes to our national decision. So after that consultation, the technical paper when that was finalized was shared again with the ministers of health of the region in 2019, October 2019, in a meeting that was hosted in Tehran. And that became a sort of a resolution as well as a technical publication. Again, the first time, I mean, that came forward, this program coming together. And within this program also, there was a clear focus on institutionalization of evidence-informed policymaking. I'm repeating this maybe too much, but I mean, I'm also proud to say the focus on national institutional capacity, again, as a sort of WHO document, that was the first time being insisted in any publication of WHO anywhere. These are important, saying that, I mean, this is learning from the experience of institutions in the region, experts from the region, but also learning from global experience. two areas we emphasize in this integrated multi-concept approach, bringing together. One was that, I mean, in the country, these programs should talk to each other. They should be systematically linked. But later on, I mean, in the following years, there were important work done on the ecosystem of evidence-informed policymaking that was published in different arena by different teams, including WHO teams across the globe, and the focus on ecosystem of the process. And so with this language, we also added to the process. So the context is that, so I mean, the reaction from countries has been very positive. The demand is very strong. The experience is there. So what we want to know together is that how we can actually making sure these work in practice better. So my intention was that I don't show a slide so that I talk shorter. I hope I managed that. Sometimes, you know, you don't show a slide, you talk longer. So I hope that wasn't the case. So I'm not going to, so I stop sharing. Is that correct? So you are not seeing anything. Yeah.
Yes.
Okay, so let's go to, I'm just opening my file. Give me a second to the plenary. So now I'm going to invite the panelists to relate to the questions that will be shared. And we've shared the draft of the question with the panelists. I'm sure they've consolidated their thoughts on how to address those. So the first, I mean, round of the question that you're asking, as Russia guided the process earlier. So in the context of the countries of the region, it's a Mediterranean region. So that's 22 countries from Morocco to Pakistan. I mean, sort of with different contexts, including high-income countries, middle-income countries, low-income countries, and then many emergency affected. How have evidence and data and knowledge shaped efforts towards a better health system, towards better health outcome for the people of the region, and of course, globally? But then what lessons we've learned from those experiences? So that's the sort of remit of how we are running the process specifically. So with that, I start the round one of questions from the panel members. And I start by asking Dr. Mehnaz Khairandish the first question. Is that, so I mean, the question I'm asking you is that, could you share some recent achievements in the translation of evidence into policy across the countries of the region, Eastern Mediterranean region, and how these efforts have contributed to more equitable health system in the region? Over to you, Mehnaz.
Hi, good morning, good afternoon, everyone. Thank you, Dr. Arash, for the introduction and also for the question. I would like also thank K2P, Dr. Fadi, Dr. Rasha, and their team for the great arrangements for this plenary session. So to respond to your question, in fact, there are several initiatives and achievements related to evidence-informed policymaking in the Eastern Mediterranean region, which is achieved recently. The countries and ministries of health in the region are showing greater commitment to this area and actively seeking evidence to inform decision-making, contributing to more equitable health systems. I will briefly explain 3 recent achievements that we had in the region from Morocco, Egypt, and Kuwait. Morocco has made significant progress by establishing a knowledge management center, and this center has facilitated the creation of a network of universities and relevant research institutions with close collaboration with Ministry of Health. And through this collaboration, Morocco has prioritized policy-oriented research and studies that address the health needs of the population, and at the same time to address the policy problems and questions which Ministry of Health faces. And this initiative in Morocco not only enhances the quality of health policies, but also ensures that these policies are grounded in solid evidence, leading to better health outcomes. Another achievement that we had recently was establishment of the national program for guideline development and adaptation in Egypt. And this initiative shows the successful engagement holders together. A country can effectively manage the conflict of interest and ensure that different perspectives are considered in the process of policy making. And I can say that this level of political and national commitment in Egypt in this program is critical for a long-term health improvement and ensuring the guidelines are not only developed based on evidence, but also implemented effectively. I also want to mention the third successful experience that we had in our region from Kuwait, which was establishment of a dedicated unit for evidence to policy within the Ministry of Health, which is leading the agenda for evidence-informed policy making for health in the country. And as a result of this unit and initiative, Kuwait has developed a national action plan for institutionalizing evidence-informed policy making in the country, which is a very great success in the country. And just to conclude, I can say all these efforts reflect a broader term and trend in the region, where the countries are increasingly recognizing the importance of data and evidence to inform policy-making processes and for decision-making to be more inclusive and effective and have more impacts on the health outcomes. And WHO Regional Office for Eastern Mediterranean has committed to support the countries in the region, all 22 countries in the region, to develop the institutional capacity for evidence-informed policy making, which, as you mentioned, Dr. Arash, in your presentation, which is intensified since 2019 after the resolution that we had from the regional committee in that year to support countries for evidence-informed policy making for health. Thank you. I stop here. Over to you, Dr. Arash.
Many thanks, Mehnaz. I'm grateful that you shared the experience of 3 different countries of the region, and I'm really glad to hear those positive, experiences and the success that we are observing. I'm sure there is plenty more that colleagues will share. Also, thank you to remaining, concise in your presentation. So now I move to the second panelist. So that would be to Dr. Sultana Al-Sabahi. And so as I introduced her earlier, she has a lot of experience, especially in making sure that the country moves more strongly in areas of use of evidence in decision making. So Sultana, drawing on your work on knowledge translation at the Ministry of Health in Oman, what are some of the key insights that you can share? What lessons, in terms of what to do, what to avoid, what lessons you can share in terms of for wider context, and what strategies have been effective in particular in enhancing evidence-informed policymaking in the country? Please go ahead.
Thank you very much, Arash, and thank you to K2P Center for organizing this event. So I will try to make it short. So far, maybe you know that in the last couple of years that we faced a lot of change in the top management and the middle management in the Ministry of Health. And I see that was very positive because now I see one of the strongest strategy that they have been utilizing and chose to be effective. It's the direct communication with the top managers and to gain the trust. And we know that having the trust between policymakers and the researchers is very important. So gaining that trust and trying also to help the policymakers asking the right questions. So usually, unfortunately, I noticed that policymakers came with kind of solutions that they want to prove. But I always try in a very respectful way to pull them a little bit a step back and to ask them, tell me what is the burning question you are trying to answer here. And with that, without saying that this is right or wrong, but by forcing them or help them to ask me the question and not to give me the solutions, that will be my entrance to help them by saying, okay, let's look to the other options and we will take it from there. So that having a frequent communication and meetings one-to-one or in a group with the policymakers at a different level was very helpful because with that we gain the trust And if they trust and they know that they have some people who are capable to help and support them, that will facilitate not only that I push from my side, but it also facilitates the other side, that they start to call me and ask me for the support when they feel they needed that, and there is a need to utilize the different evidence. And I take that with them through different questions, because by doing so, kind of we manage to, first of all, ask the right question and then to look for the all available options. The second strategy is the capacity building. I have been trying to build the capacity at the different level in the ministry, starting with the big hospital and institutions that belong to the Ministry of Health. And now, inshallah, soon we are trying to collaborate with Plenary to even organize a longer and more in-depth training for the different level of researchers and policymakers. So capacity building and constant capacity building and awareness is very important, because the turnover is very high and the change is very fast. So we need to make sure that we are on top of everything. The third is, and this is very important, actually, it's noticing what the language the policymakers are using, and to try to use that language to the nearest to the field of knowledge translation and evidence-informed decision making. For example, we always say we need to contextualize the evidence and we need to bring evidence and what is available there. And I noticed actually people and policymakers, especially not only from the health sectors, but also from outside health sectors, they are using a similar language, for example, the benchmarking. So I realized that when they talk about the benchmarking, that they mean about looking at the other country's experience. And that is a very important kind of type of evidence. So we are there. They do want to use evidence, but it's now a matter of how to help them, bringing it in the right context and putting it in the right way to be suitable for our context. So noticing what language they use and where does that fit in our journey for the knowledge translation is very important as well. And according to that, we managed to open collaborations between healthcare providers like Ministry of Health and between academic institutions, because they also realize that we don't have much of researchers in the Ministry of Health. So capitalizing on the researchers available in the academic institution is important. And we also managed just to allocate, for example, Sultan Qaboos University, they have His Majesty Research Fund. And with that collaboration, we managed to allocate part of the fund for knowledge translation or evidence-informed decision-making research. And there was a bit of a curiosity. I think multiple proposal has been submitted for that regards. And of course, we try to broaden that by my latest publications about what is the role of behavioral science and implementation science in relation to the evidence-informed decision-making, because they always ask the question, what's after? Okay, now we bring this, we bring the evidence, but still sometimes we face the challenge. So why? And we realize that the gap, because we have not been taking carefully the human factors and the change management and behavioral science in board in the right way. So I will stop here and back to you, Arash. Thank you.
Yeah. And many thanks, Sultana. And I'm grateful for the responses and the experiences you shared. I also want to emphasize, I mean, you describe it beautifully from inside the Ministry of Health. I mean, being in a unit that has a role to enhance evidence-informed policymaking, so how to gain the trust of the policymaker within the Ministry of Health as the support unit or the decision facilitator unit, but also enhancing the capacity for a wider community. But then you moved on to saying that how the national context and the ecosystem for research, the link with the academia can play a role. All important lessons that you kindly share. So now from the sort of the eastern side of the Eastern Mediterranean region, we go to the western side of it, to Morocco, and with Professor Shakib Najari. So, I mean, the question I'm going to ask you, and grateful again for joining us in this session, as a Dean of Public Health, I mean, with that important experience, how do you look at the sort of, I mean, enhancing the academia capacity and role? I mean, specifically, how are the educational curricula evolving to better integrate evidence-based practices and within the sort of the training of health professionals, related groups, and how that can help to train better leaders to use evidence for tackling the challenges we face in terms of achieving UHC, climate change, and all the challenges we all have. So over to you, Shakib.
Okay. Thank you. Thank you for your kind invitation. It's a great honor for me to be around this virtual table, and I hope we can develop in the future very interesting collaboration. As you know, Morocco now is conduct a real overhaul of the health system. So in this period in Morocco is very, very important, and it's very important to have a kind of awareness to integrate more and more evidence-based practice here in Morocco. Educational curricula in health here in Morocco, regarding my experience here in as a president of Mohammed VI University in Casablanca, and now as responsible here in Euromed University in Fez, are evolving, but should evolve more and more to incorporate evidence-based practice and prepare future health leader, because there are very, very important and pressing challenges such as universal health coverage. Here in Morocco is the first time we have universal health coverage in the whole country, and also some other challenges like climate change and some specific situation in our region. So there are many key trends and approach to integrate and incorporate evidence-based practice in education. I think first that is very important to integrate many disciplines such as public health, environmental science, social science, and to have a kind of holistic understanding of health issues. It's something very important. In Morocco, we have an experience, but we should evolve more in this direction. And the interdisciplinary training health, of course, will help future leader to address complex challenges and span multiple sectors. I think also we should emphasize the importance of evidence-based decision-making by incorporating training in research method that analyzes critical appraisal of literature. Also, the environmental dimension is very important. Now, many programs are now addressing this question, the impact of climate change on health, by including courses on environmental health. Also, I think that in our curricula, we should have more inclusion of community engagement and service learning. I think that curricula should integrate more and more community service project and partnership with the local organization. Finally, I would like that maybe the key for my point of view is more and more collaboration between our countries, within the country, and sometimes within our institution, because collaboration, I think, is the key to success, to incorporate this to incorporate evidence-based practice is something very, very, very important. And I think also, according to my experience, we should open our universities to decision makers, to politician makers, to socioeconomic sectors. It's very important to have very, very active interaction between university and the environment on university. Thank you. Thank you so much.
Many thanks indeed, Shakib. And I'm also very glad that you also referred not only to your experience at the University of Fez, but also what you had done during your tenure with the University of Mohammed VI. And in a way, it was also a very good, I mean, the further reflection and insight into the work that, I mean, Mehnaz was referring to in Morocco, because of, I mean, with the those excellent efforts. I mean, Mohammed VI University is now also playing a role as a hub for expanding capacity in the whole of Morocco in terms of evidence-informed policymaking and hopefully beyond that. So, I mean, seeing that from inside the universities and how that capacity should be generated, how to respond to the policymakers is really important, especially that many of us, and that includes me as well. I mean, I'm also I've been a proud academician. We sort of, a lot of the good work we do, I mean, is starting from academia, and then would be important how to make that responsive and reflective to what is expected by the policymakers. So with that, I think would be a very relevant juncture to invite the next speaker, panelist would be Professor Ahmed Mandil, that he's again coming now from the country of Egypt, based in Alexandria, University of Alexandria, High Institute of Public Health there, but then also as his role that he has had with the WHO over several years, and also, of course, working in different institutions in the region, not only in Egypt, but also in UAE and Saudi Arabia. So that wealth of experience helps the insight. So going again to the issue of research part of it, the role of academia, what should be done to enhance research for health in AMR countries? What are the key priority areas of action to go forward? So Ahmed, over to you.
Thanks very much for inviting me to this panel. It's a pleasure and an honor to be with you this afternoon. As a matter of fact, enhancing research for health should always go with the WHO strategy for health, which was established more than 20 years ago. So we have 4 areas to actually think about, Dr. Rashidian. First of all, setting priorities. Secondly, capacity building and strengthening. And thirdly, setting and observing standards. And finally, supporting knowledge translation. So as far as setting priorities are concerned, we should always aim at meeting the local and national health needs and linking research to national health and public health priorities. And you know very well that the regional office has been working very closely with many member states in the region in trying to establish the best health research priorities. And this has happened in support of Egypt, Jordan, Pakistan, and Qatar. And this is on a national scale, but also we have been supporting sub-national activities as well as regional activities. When it comes to regional activities, capacity building and strengthening in support of just health systems, especially in domains of epidemiology, biostatistics, research methods and ethics, as well as evidence and data for policy making. The third domain should be setting and observing standards for conducting research for health, as well as observing ethics governance. And this is through fostering national ethics and bioethics committees. But on institutional scale, we support the building and enhancement of IRBs, or institutional review boards. The evidence being generated, the capacities being developed, then we go for knowledge translation and transfer using research evidence for health policy making. And I don't know if you mentioned the second half of the question already, as far as the key priorities. Should I move to it?
And I didn't realize my mic was muted. Yes, please go ahead.
Thank you so much, Dr. Rashidian. So key priorities would include things like the following. From MDGs to SDGs, is the world ready for achieving universal health coverage by 2030? The second one could be assessing healthcare delivery during emergencies, with special emphasis on migrant, refugee, and IDP populations. A third priority could be to revisit re-emerging communicable diseases. We thought that the communicable disease agenda has been done with, and the communicable diseases have been controlled. Wrong we are. With emergencies and social conflicts, we are seeing polio again, we are seeing cholera outbreaks, we are seeing TB again, and massive skin infections. So I think prevention and control and research on re-emerging communicable diseases could be another research priority. Antimicrobial resistance, magnitude, and role of different stakeholders, whether people who write prescriptions, people who dispense them, or people who use them. I mean, this is a big area of work, and in our region and in many low and middle income countries, it's a big problem. And the prevention and control possibilities and challenges could be a good area of research. Mental health during and after conflict settings is a very important area of work which could direct research for health, as well as enhancing evidence generation and utilization, the role of AI and machine learning. And finally, the NCD prevention and control equity, as well as modern management schemes, not only the traditional surgery, chemotherapy, but also pain therapy. So these are some suggestions, Dr. Rashidian, for research for health in our region. Thank you.
Many thanks indeed, Ahmed. That's very valuable. And you highlighted, I mean, the issue of the sort of things that, I mean, we categorize under research governance. I mean, make sure that priorities are well identified, priorities addressed, and addressed in a sort of ethical and standard way with the correct methodology. And also you linked it to the concept of the knowledge translation, which is the main focus of all the panel that we have, so that it results to health system issues. And we know many of these things are much more difficult done than said. I mean, sort of setting the national priorities for research is a difficult thing, but more difficulty would be to make sure it happens and it responds. And that's a lot of experience there, and I'm really grateful for highlighting those areas of need. So with that one, I move to the next panelist. So now a bit of shift from sort of research to data. Again, as another key source of evidence, especially when it comes to national decisions. And with that, I'm glad to invite Professor Ali Mokhtar to take the floor. As mentioned, I mean, his experience in the region is massive, but also in his sort of country of US, I mean, adopted country of US that he's based, but then at the IHME, working to shape the global agenda of use of data. So with all of this, Ali, the question to you is that from a health metrics and data to policy perspective, what would you say are the existing gaps in the use of health metrics and data analytics for decision-making in the EMR? Over to you.
Thanks, Dr. Rashidian. It's a pleasure to be with all of you and to join you. I want to talk briefly about lack of data, quality of data, analysis of data, and the use of data in policy. We all talk in our region about the lack of data, but it's very important to highlight what we mean by lack of data. So many countries in our region don't have a vital registration system, for example. So we don't know how many people are born, how many people are dying, and what they are dying from. We also don't have a good data sources for many of the risk factors that are leading risk factors or injuries in our region. I mean, diet, for example, we don't have good data on diet. So even data on disability, we don't know how much certain diseases and injuries cause disability in our region. We don't have that. We don't have in our region data, for example, on linking an exposure to an outcome. So we know relative risk. We use these relative risks from other countries, from other studies. So I have a lot of issues when it comes to lack of data. And let me talk a little bit about the quality and use of data. And I'm talking here about the people who collect the data. And then come and talk about in general in our region when it comes to quality and analysis of data. Even the people who collect the data, the institutions that collect data in our region, there is, and not all of them, but in many circumstances, there is no clear indication of how the data was collected, how representative it is, what the biases are. So the issues of training that Dr. Mandil brought up and Dr. Al-Jadari talked briefly about it is how could we train people to do it right in order to tell us what data did they collect, how did they collect it. The same people who collect data don't provide much analysis of their data. I mean, you collect the data, you know more than anybody else about your data. There is a lack of analytical capacity that provides analysis beside the standard reports that we put out there. And all of this, of course, these problems that I'm discussing will impede our ability to use data for policy in our region because we don't have the good data that we can base our policies on. We don't have the data and the trends so we can shift our policy or change our policy based on what we see and what's happening. COVID-19 showed us, for example, how trends are important and how shifting trends will happen. Dr. Mandil talked about the war, how many other diseases are surfacing right now that we were not even considering. All of these issues could be resolved simply by releasing the data. If we don't release the data, and I understand people don't want the data to go outside their country, and that's okay. But within a country, release the data for your scientists. Let people use it. Let people look at it. Let people see what problems in it in order for us not to repeat the same mistake when we collect new data sets. And that these discussions are very important for us to improve the quality of data, to find out what's missing and what we need to collect. But the most important part of it at the end of the day, how to best use what we have in order to drive the best policy available at this time, and how this data could make us flexible in order to change our policy, our programs when we need to. So I'll stop here, but briefly, there is a lot of things that we need to do. I'll end up with an example from what we do at IHME. You mentioned, Dr. Rashidian. We release our data at IHME because it's a public good. We have to release the data. We have to release the program and the codes that produce the tables and the numbers. And what we are realizing right now for IHME, more than half of the publications from our data, from the global burden of disease, are done people outside our collaborator network. It's not done by us. And you have quality papers that are coming up, and the reason they're coming up, that they're improving our data, one. Two, they're making us better at analyzing our data, because if we produce a number and somebody is going to publish a paper on cardiovascular disease before us, so it's even motivating our people to analyze our data and to produce number. And I think by releasing data in a country, you not only improve the quality of data, but you've, in a way, push the people who are collecting the data to publish from that data, because they know when it's public, others will beat them to the publication. Over.
Many thanks indeed, Ali. I mean, that was a very important intervention that you had. I mean, taking us back to the rule, saying that before thinking of how to use data for decision making, make sure the data itself is correct data, correctly measured, correctly collected, correctly analyzed. And with that, I mean, it goes all to the issue of, I mean, all the data that routinely and sort of on a daily basis is generated within the health system. I mean, the health information system. And so if you refer to the CRBS, I mean, civil registration, vital statistics data, and we know that the challenges that exist there. And within those, I mean, so how that can help, and then the importance of sharing the data. I mean, just last week, there was a regional forum hosted in Sharjah by the government of UAE. And a lot of discussion was about sort of how the data can be better shared among countries and within countries as a key priority for our region. And many thanks to flag that again in the discussion, as well as inviting people to use the resources that you have in the IHME. So now I go to our next panelist. In this round would be the last person as the panelist, so would be not least, would be Professor Nasrin Jassani. I mean, Nasrin, I mean, I refer to your experience in several countries, also the role you do with also international organization. And based on that experience, especially conducted in low and middle income countries, going back again to the academia discussion, what role could academia play better in promoting evidence-informed policymaking in line with the SDG agenda and objectives?
Thank you, Dr. Arash, and thank you for inviting me to join this esteemed panel. I must state upfront, like Dr. Arash said, that I'm not an EMR expert in the least bit, and I have a little bit of imposter syndrome while I listen to our regional colleagues right now. But anyways, on your question, I think I could probably provide generic answers as to how academia could play a role in evidence-informed policymaking. But I think what I've learned the most from my work is that, and this has been mentioned implicitly and explicitly by some of the other colleagues here, is that the success of any engagement comes down to relationships and the trust that's been built. And this is not only with respect to academia, but with all the actors, right, in the evidence ecosystem. But on a practical note, I think I'll build a little bit on Dr. Shakib's thoughtful reflections, and I'd suggest that perhaps all schools that teach research granting degrees, whether at bachelor's, master's, or doctoral level, that these schools or universities must absolutely embed training in the evidence to action cycle. And by that, I mean that there must be a recognition of the value of research as an endeavor to champion change. not as an endeavor to, the incentive structures are a little bit off at the moment. And I think that that change can only occur if researchers understand and engage with decision-making powers, the processes and the practices. But this shouldn't stop at the theory level, right? We need experiential knowledge as well, because it's really hard to imagine what does this mean in practice when you're just a student and it seems like engaging with decision makers is 10, 15 years into the future. And so I think what would be important is that, we need to think about reimagining our curricula a little bit so that we can see our students engaging with decision makers through simulations, through exchanges, through internships, through placements, and other unique forms of learning. So for instance, I've always been impressed by colleagues in Thailand that embed the shadowing of high-level events like the World Health Assembly for their policy fellows. Similarly, colleagues in South Africa embed simulations of highly charged community dialogues for students to understand their perspectives of different actors and their interest in a particular policy. So I think these learning strategies demonstrate how imperative it is to understand the value of diplomacy, of soft power, of negotiations, of priority setting, and the deliberation processes. Second, I think in terms of the role of academia, I truly believe that there needs to be less siloing in our universities and more multi-sectoral learning. If we're truly thinking about the SDG agenda, and maybe it's not about just thinking about how we work across sectors, but how do we rethink the way our faculties and our schools are structured so that they're less thematic and more human-centered in their design and problem-focused in their approaches. I think as a third point, we need to see a concerted effort with considering a revised incentive policy structure within academia that recognizes and rewards the efforts and the engagements that researchers have with decision makers in order to influence change. These are time-consuming. They're intangible. They need long-term visions, and these can't be counted or tabulated on a CV for promotional purposes. But yet these incentives affect the way that we behave and the decisions that we make in how we want to, but cannot always affect change. And I think lastly, I think partnerships with the research users should be considered as imperative, if not more than those with funders. Much time goes into engaging with donors and research funders and partners in research. But the academic teams that invest in partnerships with the policymakers and the decision makers and the communities perhaps have a higher chance of making sure that their research actually reaches the people who are impacted by the results. And this links again to incentives, but also positioning academia as an intermediary. So I'll stop there. Thank you.
Excellent, Nasreen. I mean, several really valuable points that you highlighted and also linked them very well with the context of the discussion and the question that we have, but I'm really grateful for that. I mean, what you mentioned about sort of placement and shadowing, and especially in international relationship, that's absolutely important. And I don't think we have much of a strong experience in these areas in countries of our region for different reasons. Of course, I mean, international institutions do some work on that. For example, I mean, in EMRO, we do a fellowship program every 2 years. There are about 30, 40 young individuals that are recruited through a competitive basis to come to WHO, spend with WHO 3 to 6 months. We found that really helpful. But then more than this should be done and in a much wider base, and should be also from the academia. I mean, recently I was in a global event, and from one university in China, there were about over 20 young scholars that had been funded by the university to attend that event. And I thought that's impressive. While again, in our region, we don't do that. And because of economic crunch that affecting many countries of the region, it has become even more difficult. And we see that we have had that discussion with Fadi several times in terms of over the years, the presence of the region in the health system global event, for example, health system research symposium, and which is not very strong. And there are other factors apart from that, but I mean, that's also one factor we need to do. On the issue of the incentive, I wanted to highlight that as well. I mean, probably this, I mean, in terms of the process, I would add this as one of the, perhaps still also a research question, how to do it better. Because I'm aware of countries that they try to do it, but it was so difficult to make it sort of objective, to not become cronyism, how to measure it, because in academia, so let's say that's an issue, then how to present it, how to gain it, how to attract it. And many of academicians that actually go to that, they sacrifice certain personal promotions because of those impact, which is of value. So with all of these, I mean, now I have a pleasure of inviting Fadi back. So asking for his remarks and reflections on all the insights. And I mean, we didn't have a sort of a detailed report, the introduction to Fadi, and probably everybody knows, but I mean, Fadi has been an instrumental person for evidence-informed policymaking in our region at a global level, very well known. I mean, sort of obviously many years leading and establishing and working through the K2P Center, but you also work globally with many countries in our region and also at the wider globe, and with many of us on an individual basis, but also at the wider range. So with all of that experience, obviously, we expect from you a very short remark, but please go ahead. Thanks.
Well, thank you, Dr. Arash. Thanks for everyone. I think this is really quite exciting and insightful. Just more of a maybe just quick reflection. I think it's I'm so delighted to actually hear about again some of the work that was done by the show EMRO in collaboration with different member states when it comes to evidence to policy work. Also delighted to see the progress being made on Oman and the experience also at this level. Also very much excited also to see and to focus a little bit on this from an academic standpoint, particularly at the level of the role of university and the engagement that university should do also with the policy world and the decision maker. This is really quite interesting. I think there's a lot of interesting, I would expect in the next few years, there will be interesting initiatives that will actually also take place in our region when it comes to the university engagement with the in public policy in general. And I like the systemization of what we mentioned. Let's start by the priorities, building capacity, making sure that we have the right standard, but also making sure that we're asking the so what, meaning how we can actually get evidence to policy. Also, I think the points that were mentioned about the role of data is extremely important. Do we have the right data? Do we have the data that is measured in the right way? Do we know about the gaps? But more importantly, not only about the quality, that really how we are building the right narrative, as Dr. Ali mentioned, how we are building, how we're putting the right story around the numbers. I think this is very important. I would actually even argue that there are a lot of capacity needs here. Capacity building really required of how to take this forward, to make it really quite, put the right narrative to create a sense of urgency, but also to prompt action at the level of evidence. But I think the point that was made as well by Dr. Ali, not only on the analysis and the narrative, but also on the how we can make data publicly accessible. I mean, I love the word when I say that data is a public good. I fully believe in that. I think this is very important, but unfortunately in our region we're not yet there. And I think there's a lot of work needs to be done yet to get it to this level, because I think the whole will be bigger than some of the parts when we look at data and we allow organizations and researchers to work on data and actually try to inform evidence. The point about the curriculum, I think this is quite interesting, Nazreen, and I think it's something to be also looked at when it comes to revisiting, as you mentioned, to use your word, reimagining the existing curricula. Absolutely. I mean, knowledge translation, evidence to policy need to be embedded now in the at least schools of public health, but at the same time creating that incentives, the different modalities of how those courses are provided. It's good to know also about the experiences of other countries, of how they are actually innovation that they are introducing. I just wanted to, I have to say, and just to reflect a little bit, and we had, in fact, 3 weeks ago or 4 weeks ago, I don't know, in Prague, there was the Global Evidence Summit, and there was a lot of interesting discussion taking place there. I know Dr. Arash was there, among other colleagues, Nazreen as well. And I think one of the key things that came also across the board is that there was a lot of discussion about artificial intelligence and what that means to evidence synthesis, what that means to policy support, to policy advice. I think we need to put more efforts also to understand that world and to understand what type of tools that can be used, AI tools that can be used to allow us actually to provide a much more high quality evidence, but also synthesized in a rapid way, so we can provide real-time advice. And I think Dr. Ali mentioned, I mean, we've learned the hard lesson from the COVID-19. The other thing it came across as well in that discussion it came also and reflected by your interventions about to strengthen the institutionalization of the use of evidence. So basically, we always say that we're living a golden era when it comes to science and evidence, but again, as Dr. Ali mentioned, the COVID-19 pandemic also exposed the harsh truths that our current approach of how we actually conduct research, how we actually engage with policymakers, how we advise, still to a certain extent inefficient, passive, and unsustainable. And I think this is so. I think one of the things also that was also some of you already alluded to that if you look at climate change, for example. So in climate change, you need to actually work across disciplines. You need to actually work with researchers and get data when it comes to environmental science, to public health, to social policy, to economics. And I think we still, unfortunately, even at the academic level, we have a lot of fragmentations, and the existing structure sometimes it creates a perverse incentive for us to actually bridge those disciplines and start really to answer the right questions and provide real-time evidence to decision makers. So I think the issue about the synergy working across the disciplines, my argument that we cannot afford anymore to let the evidence, I would say, sit on the sidelines when it comes to how we make decisions. So yes, if we say evidence and data must be at the heart of every policy, then and every intervention. So this should not be the exception. This should be the norm. The question in our region, and as also in other regions, I think we talk about evidence, but we always look at it and focusing on a single discipline. So I think going into a cross-disciplinary collaboration requires a different way of how we can pull data and evidence from the economics, from sociology, from environmental science, from public health, you name it. But I think unfortunately, we're not yet there. And that's something I wanted to maybe to end. Absolutely, I fully agree with you. These are really quite insightful remarks. The institutionalization, the building the capacity, the integration, different forms of evidence. I think it was mentioned that experiential knowledge, not everything is published, not everything is really put in high quality impact factor journal or so, but there are important data that is really important to be harnessed, particularly when it comes to local data that allow us to understand the significance of the problem, the cause of the problem, to what extent the option would be feasible in our context, to what extent this could be implementable at the level of options. I think that the integration of the different form of evidence is very important. We talk about universal coverage. I've seen countries, definitely they look at systematic reviews and they advise when it comes to what is the best modalities, but also we all know that there are other companies or firms, they do actuarial studies. Others, they do political economy analysis. Others, they do different. All this can come to bear to support let's say a draft law universal coverage, but sometimes we don't work together to do so. So the question is how we can integrate the different forms of evidence and how we can really have in each of our countries in the member state to have really a platform that can actually help support, shape, influence decision-making. I believe that, hopefully with this pre-conference, this could be a good opportunity in our region with the great work that WHO AMRO is doing with the other universities that is, also supporting this work in the different countries in the region with the energy and the passion. I think it's important to move this forward and maybe address I would say the decision-making ecosystem, particularly when it comes to health and how we can really better work together. So we are at a crossroad in our region. I think we are more now, I would say, identifying and deep diving into each of those inefficiencies and fragmentations, but also at the same time highlighting those opportunities. So how we can break the silos and integrate more and more knowledge and expertise to shape, I would say, a much more sustainable public health system in the region. Sorry if I took a lot of time on this, and I just wanted to mention maybe before I give it to you, Arash, and then to Rasha. I think this is again, it's an important to actually maybe I would say, emphasize the tremendous potential that we have in our region. Really, we have a tremendous potential, not only at the level of research, but also at the level of policy. We have tremendous potential at the level of health systems. And I think hopefully, but at the same time, we have significant challenges. I'm hoping that with the work that is being done now, with the priority that is being identified, with the ETHG EMR network, with all the partners that is really working together, that we can really take those insights and that we already learned over the last, I would say, session, including today, to take it into actions. I think this would be really extremely important. So thank you so much, Arash, for moderating. Over to you, and then Rasha.
Many thanks, Fadi. I mean, that was excellent. Now, just, I mean, Fadi, this was only the first round of the thing, so we are not yet close to closing. But
well, fine.
Yeah. So just, but Rasha, do you have any? Would you like to share any reflections at this stage, or do you prefer to do it
No,
after
thank you,
the second?
Arash. I will do it till the closing.
Okay, very good. Many thanks. So that was really good. I mean, Fadi, I mean, nothing less was expected from you. I mean, so you highlighted some key factors, areas, and then ending with the high note that how we can do further and take it forward. And the only thing I would add is that sort of when we talk of the region, we are not also within the sort of definition of how WHO defines EMRO. So region means actually countries like us. I mean, having Nasreen, and country like us probably is every country. So as I mentioned, the region has all categories. And for example, I mean, the experience Nasreen was sharing from her background was totally relevant to the context. I mean, so although, I mean, she didn't have direct experience in countries of the region. And then a lot of the experience that we do also goes beyond. So, and none of the programs are about sort of being limited to what we have in the region, but rather, I mean, in a way, working as a community, as a mandate together. And within that mandate, one network that I would like to highlight, just because it's not part of the question, but it's a good excuse that you would now highlight, Fadi, to mention, is a network of institutions for evidence and data to policy, which is a branch of EVIPNet for the region, but at the same time, it's different from the total evidence structure, EVIPNet structure, because it's institution members. So it includes, I think, Mehrad would correct me if I'm wrong, but I think it's, at the moment, it stands at 35 institutions from all countries of the region, and is expanding. And that's also a major platform for interaction that should be done. Further work could be done there. So with that, with all of this, I go to the second one. But I mean, in terms of actuality check, or whatever the term is for that. So we are about 50 minutes within or beyond. So how much time has, oh no, sorry, 1 hour, 20 minutes within. So we've got only 40 minutes left. So I'm actually humbly requesting all the panelists to spend about, let's say, 2 minutes and a half in answering the question. So please be brief and mention maybe one key element when in your reflection, so that we have some time left to open to the floor for sort of the participants. I mean, there has been many colleagues online. I mean, at one stage was about 50 people. Now it stands about 40 plus. So with that, I go to the second one, and starting with Sultana. So now it's going from that another element of bringing, so the focus of the previous intervention in your remarks was on Ministry of Health in Oman, but now it's going sort of within the sort of network of policymaking institutions. And then from your point of view, what innovative methods of models of collaboration and institutional arrangements can be adopted to strengthen the use of evidence within policymaking institutions, so linking different types of institutions with their relevant role together. Over to you.
Okay, so thank you very much. I will highlight now here an example. Oman has been adopted from the since 2020, when the issue is really cross-sectoral, and they need that a higher authority to take lead of that project. So Oman has been adopting the initiatives of establishing a short-term national program. So for example, there was sustainability kind of a program, and these national programs, they are established by a royal decree They have a specific time frame. These programs, I am now seconded to one of them, and they are empowered. They have a specific mandates and specific tasks, and they are allowed to they should actually bring all of the relevant institutions to solve a specific questions that is burning for the policymakers. So this empowered program, actually, they created a good examples for how to bring the different institutions together without having that power dynamic, like this is under my scope or under someone else's scope. So these programs become as a mutual body. They bring all the relevant bodies together to solve and to handle any specific research question. So this is one. The other example, like, I don't know how much I can reveal out of this. The issue of finding and synthesizing research evidence in a short time is still an ongoing issue. So now here in Oman, I'm developing an AI-based tool. The coding, everything is fully completed. I'm just waiting for that system to be in the public domain. Hopefully within this month, it will be available. And the idea of this kind of tool, it will only collect and synthesize data or information for you from a peer-reviewed journal. It will not bring everything out there, whether it is scientific or non-scientific. So this is very customized to bring data only from research, from peer-reviewed journal. And it will allow you that interaction with the tool to modify the questions according to the field, and then customize the summary in a different way. You can add some component or remove some component. Of course, this will be the phase one of this tool, and I'm sure that as more people will start to interact with this, more a better version and a modified version will be highlighted there. So I hope that soon I will be able to share this tool. It is available for the public soon, inshallah. Thank you.
Okay, many thanks indeed, and thanks for sharing the good news about the sort of work that is happening in Oman in developing tools. And also, I mean, the response to the key question was sort of an example of how to formalize, I mean, institutional collaborations to ensure that there is a sort of shared partnership among those. So still, I'm encouraging everybody to remain concise, as Sultana was, and going ahead quickly. So now I'm going to Mehnaz. So what key institutional capacities are necessary to promote and institutionalize evidence-informed decision-making in the EMR?
Thank you, Dr. Arash, for this question. To effectively institutionalize evidence-informed policymaking, there are several key capacities, I can say, contributing to this success. That when I was listening to the esteemed colleagues and panelists, they have referred to some of these key elements. I want to categorize them under four main categories. There are technical capacity, executive capacity, integration of relevant technical programs and sources of evidence and data, and strengthening the ministries of health. So by technical capacity building, I mean developing a kind of a strong foundation in research capacity, research governance, and research methodologies, data analysis, data and evidence interpretation to policy and practice, and also our technical capacity in terms of measuring the impact for health outcomes. And this means that the health professionals and policymakers should be trained more in terms of understanding, appraising, and utilizing evidence and data for policymaking and decision-making. And the second factor of capacity is executive capacity, which means that we need a stronger leadership, which is important and crucial to foster a culture. And as you mentioned also, Dr. Arash and other colleagues, the ecosystem for evidence that values evidence-informed policymaking. And this means that, we need to establish, there is a need for establishment of the clear processes and structures that support the integration of evidence and data into health systems and health policymaking processes. The third factor or capacity that I can mention is integration of relevant technical programs, or I can say there are different sources of evidence and data that you also nicely mentioned in your presentation at the beginning, Dr. Arash, that it is really vital that different sources, such as, for example, when it goes to knowledge translation processes, different types of evidence products, health information systems, programs for guideline development and adaptation, or for example, programs for health technology assessments. So these all needs to be interconnected in a way that, you know, to inform efficient decision-making and evidence-informed decision-making. And the last category that I can say is strengthening the Ministry of Health. I think that the Ministry of Health should be empowered to take a leading role in promoting the evidence-informed policy-making agenda for health in the country by providing the necessary sources, ensuring that evidence is consistently integrated into decision-making, and quality local evidence and data is available for decision-making. Thank you so much. I will stop here. Over to you, Dr. Arash.
Many thanks again, Mehnaz, and I mean, for being concise, but also to give it a structurized approach towards what should be done at an institutional level, things that are the job of the institution and should be done within the institution, but things that are from a wider context when we have a program of enhancing institutional capacity. I'm very grateful for that. So quickly going over to Nasreen, and so I mean, colleagues refer to the COVID-19 related experience, and what we learned and what we sort of had as an hindsight after the pandemic. So it further highlighted the importance of utilizing multiple forms of evidence for effective decision-making. How can we better integrate different forms of evidence? And so, I mean, such as data analytics, predictive modeling, cross-sector research. I mean, these were approaches that were commonly related to decisions proposed for policymakers during the COVID pandemic. But the other sources, for example, those referred to by Mehnaz in just her intervention. So what are the approaches that you would propose, Nasreen, for taking that forward?
Thanks, Arash. So it's a really important, but I think it is an elusive question in some ways. So the pandemic did demonstrate the need, but also the value of considering different forms of evidence. And I think the emergency nature of the pandemic allowed us the privilege of putting egos aside a little bit with respect to the traditional hierarchies of evidence, right? And so I experienced the pandemic from South Africa. And as you all know, in South Africa, kept identifying new strains. We were misunderstood as hosts of these strains and then globally punished through global exclusion and connection. So there's also this danger of like, how do you use the evidence? How do you communicate the evidence? What evidence do people care about, and what's considered relevant? But in South Africa and many other countries, we did look to modeling, to health technology assessments, to evaluations, rapid research, but also the lived experiences and the opinions of the public for the solutions to decision making. But I worry, as perhaps you do as well, which is why this question comes up, is that this might have been short-lived, and we've all fallen back into the usual ways of working. So perhaps a few ways to ensure that the integration keeps occurring is, I think it comes down a little bit to capacity building. I think there needs to be perhaps more multi-method training in our programs. So I think researchers are aware of the power and the perils of different methods and their purposes, including which are able to provide real-time data and when that's important, but which can provide us with more long-term trends and analytics to be able to note progress. And taking some of those kind of multi-methods from different disciplines. So similarly, to understand the social nuances as well of how systems are performing and the value of lived experiences. So I think when we don't understand all the potential methods that could assist in answering research questions, we don't even end up considering them. And this undermines the rigor with which we could better respond to a question, and furthermore, to invite the right experts to work with us. So I would love for myself, colleagues, in general, the research community to move from, I don't know what I don't know, to I do know what I don't know, and I know now how to fill the gap. And similarly, I think we need to equip those who are commissioning research with the right questions so that decision makers are holding us to account, and they can allow us to unpack the right methods to get to the right questions and then the desired outcomes. So this challenge to researchers to also think differently, to consider various angles, and to co-design with the demand user something that's mutually agreeable and relevant. And I think when we come back to thinking about this multidisciplinarity, I think it's difficult in the sense that we have to think about what does this mean in terms of structures for cross-sector teamwork? What does it mean in terms of the other types of competencies that we need to manage diverse expert teams? And then what does this mean, lastly, in the skills that we need to translate between disciplinary languages and paradigms? And I think these are all questions that I think I'm still pondering over, and they may not directly answer your question, Arash, but I think perhaps the things that we should be unpacking a little bit more as we address these kind of challenges.
Many thanks, and I'm grateful for the way you approach it. So providing insight, but also sharing the areas that are not easy to address. And what I really like, I mean, in your analogy was the issue of sort of talking about the individual capacity to understand the value of other disciplines, something that in disciplinary training is always missed because of sometimes even the same methods, because they have different terminologies, different terms in different disciplines. I mean, they result in big miscommunication between among, let's say, statisticians and econometricians. The same methodology, they call it differently, and then they cannot communicate really well. But then the issue becomes then how to make sure that is structurally relevant. So it's going beyond the individual, because even if I, as an individual, I know if I'm in a HTA program that never talks to the guideline program, it's not going to happen. So that then that brings back to what I mean Mehnad was saying earlier, and sort of what Fadi was referring to, and the sort of the multi-concept approach we are discussing, how to make that happen, and that's what we are trying to do based on the experience of the concept of the region. I know we are very short in time, and I had promised myself I wouldn't give a sort of longer reflection, but I couldn't stop. I try to do that from now on, so hopefully. So Ali, over to you. And then again, colleagues refer to the role of AI, different examples of how to use for that, but then now a specific AI question for you, and we would value your concise reaction to that. So AI and machine learning hold great promises, of course, and that not fully utilized, and we know also there are big challenges as well. How do you see AI transforming health metrics and population health strategies? And what innovations can be absorbed that can be actually used equitably, so that it's not just within certain centers, but actually used across the board globally? Over to you.
Thanks, Arash, and I'll be brief. I just want to make a point. We talked, all of us, and Dr. Nasreen just talked about COVID and the lessons. One thing we learned in COVID-19, and Fadi, this is something very important for all of us, is how could we in health metrics or in health profession make a decision based on the data, or not enough data, but we need to make a decision. And we need to make a policy today, and how we could go convey to the public that we're going to change it tomorrow because we have more data coming. We know what we're doing, but based on the data today, that's the decision I need to make. That's the main lesson I took from COVID-19, and it, we had to deal with it during COVID-19. AI, I'll come to AI. It's going to transform health metric, and we see it. And I tell you, at IHME, we're using AI effectively right now, and we made it accessible to everybody else. There's some issues that we had to deal with, because if you put your data on the AI, IHME releases the data, but if you put your raw data in the AI as you do the analysis, and you make it available for everybody else, somebody else can get that data. So say you're doing a new study on protein design and you're using AI, basically your secrets could be given to everybody else. So we had to go around that by getting working with Microsoft to get our own AI. So nobody could see what we are doing, but we have all the AI that we can use for our own data. And it brings stuff from outside, but it doesn't take stuff from us to go out. So if you jump over this hurdle, we're using it effectively. It can do a lot of things that we do more efficiently than we do it, in terms of programming, in terms of research, in terms of crosswalking between different questions, how they were asked. It can do even better, Fadi, and I would love to talk to you, Dr. Al-Jardali, when I see you. it can do better than anybody in our team in terms of policy briefs. I mean, it does it. It looks at the data, it gives you a best policy brief on the data. So it's going to transform what we do. However, we see right now it's creating a lot of disparities within the US and an equity problem, because some of us have access to the most recent AI from Microsoft, and we have AI capacity from Microsoft. I mean, we can look at the satellite data, tell you how many people live in a building, and then tell you how people they are moving and what they're using electricity. I can tell you what the apple production in Lebanon will be before we pick the apples in Lebanon. So it's really changing what we do. How could we make it equitable in our region? And I'll be brief. Right now, for example, I am on a board on one of the charities in the US, and Microsoft, sorry for using Microsoft, could be Google, could be anybody else, but they give that charity access to emails for free and storage. How could we reach out and make it available in our region to tell like universities that you could have access, if you have a group or a charity, you could have access to this technology for free, because price is limiting right now. How we could tell our students in a high school and in a college that you could have access to this if you are in an organization that promotes education, and you could get access to this for free in order to reduce equity. And also the most important part, and I will end up here, how can we teach our students right now in universities and high school AI and make it allowed? I mean, I am in an old generation where a calculator was not allowed in the class. And the big debate was, no, I don't want you to use the calculator. I can do my PhD in like 2 hours, what took me at CDC mainframe to do my PhD for like 3 months. So we need to empower our students, our trainee, to use AI effectively ahead of everybody else. Otherwise, we'll be left behind. Over.
Many thanks indeed, Ali. So I promise I don't say anything just to save time, but we come back in the end to some of your key reflections here. So Shakib, over to you. So in terms of, and this is actually follows really nicely with the other interventions we had earlier. So what role should academia play in promoting interdisciplinary research and action? How can we rethink curricula to better prepare for leaders, and in a way, especially when it comes to the challenges of conflict and instability, and also the climate change context? So over to you.
Thank you. Thank you so much. As you know, of course, academia play a crucial role in promoting research and action. There are many, of course, key roles that academia can fulfill. At least, as Professor Muqdad said, producing data, producing relevant data, producing good data, producing useful data is something very, very important. And I think that our academia can play very, very important role in terms of producing data. Of course, another key, very important, is to foster collaboration. We should not only create interdisciplinary collaboration, but we should bring people together by creating institutional platform for collaboration between different disciplines. As I said, public health, social science, environment, economics, biostatistics, and this can include interdisciplinary research centers and joint projects that can bring together different expertise. It's something very, very important. As you know, it's very important, and the main advancement in science were based on collaboration. Also, I think it's important to have a culture of interdisciplinary learning. Academia should promote a culture that values interdisciplinary learning through workshops, seminars, bring together scholars from various disciplines to share insight and research finding. Also, I think that academia can play a role of a bridge between research and practice by engaging with community organizations, policymakers, and health system to ensure that research informs real-world action. Also, another point is regarding our manner to learn is to encourage critical thinking and problem solving but not also problem solving, also problem formulating is something very important to incorporate in our curricula to develop research early. So the curricula should prioritize critical thinking and problem solving and problem formulating. I think also that in our context, in our region context, we should also have some training in conflict sensitivity. As you know, curricula should include training on how to address health system challenges in both peaceful and conflict setting is something I think very important, and to develop research in these topics. Finally, very quickly, I think that we can't avoid to incorporate technology and innovation, including AI, in our programs, including new technology, telemedicine, digital health solution that can prepare future leaders to leverage technology in both peaceful and conflict environment. Thank you. Thank you so much.
Many thanks indeed. And so Ahmed, is over to you. I mean, of course, I mean, all colleagues were more brief than the first round, but none of them within the 2 minutes that I had proposed. So I don't know whether you can do that or not, but I've received sort of messages from Rasha and Fadi that we are closing time. So I go to you with the last question and sort of for your kind reflection. So and the focus is on in conflict setting, when data collection is often compromised, how can research inform decision making? So I mean, within that context, and I know also your experience when you, as WHO, you work with our emergency colleagues for research in emergency context. So please bring that forward.
Thanks very much for your question. Keeping in mind the great challenges of doing research in rigorous and abiding by rigorous, research methodologies and observing ethical principles and doctrines during emergencies. These kind of challenges include protection of vulnerable groups, whether we are talking about refugees, migrants, or IDPs, conducting informed consent procedures, confidentiality of collected information and data, and then oversight activities. These are just some examples of how difficult it is to do research in conflict settings. But research for health would still assist health-related decisions via few areas, Dr. Rashidian. First of all, identification of priorities for interventions, and this would avail and help rational use of usually meager resources. Secondly, identification of the magnitude of health problems, whether emerging or re-emerging, as well as accessibility to healthcare for different groups during emergencies. Thirdly, identification of vulnerable high-risk groups, most in need of accessibility and nature of healthcare, whether preventive or curative services. And fourthly, the assessment of needs for supplies, whether medicines, vaccines, equipment, or first aid during emergencies. And lastly, the most effective interventions, especially being cost-effective during emergencies, and lessons learned. I hope I answered your question. Thank you.
Okay, many thanks indeed, Ahmed. And there is, of course, I mean, plenty more to that, but with the time, limited time that we have, I'm really grateful for the intervention. So, Fadi, any reflections at this stage, please?
No, I think it's good, and I'm just thank you so much for all the intervention. Very, very insightful. Nothing much to add. It's just more, in fact, to reinforce. The only challenge is really, I have to say, that the time. But I think the two things that maybe I have to say that clearly from what I've heard, what we have heard so far, that a lot has been done on the context of evidence to policy and data system in our region. I think clearly what we are saying that, the current reality, we need to think about institutionalization and what that means within the policymaking institution and the health sector. And the other point is really about the evidence streams and actors and the ecosystem. I think it's very clearly that came came from the reflection so far. So basically, I'm so delighted to know that there is a, the Oman experience and others. I think how we can better harness the role, how we can better harness technology and AI when it comes to evidence synthesis, and how we can really have a much more a greater impact by leveraging on AI. I think this is really quite interesting, that would allow us actually to go much more further than that. So how we can pair AI with evidence synthesis, how we can think about different disciplines, multidisciplinary approach to advance this agenda forward. I think I have to say, in the EMR, there's a lot of uncertainties still, but also it applies to other regions as well. The question really, how we can institutionalize the use of evidence across different disciplines, not only in health. So this is also important. What are the successful, important AI tools and models to harness, to leverage? I'm so delighted with what Dr. Ali also mentioned about the work that they are doing at their institute. I think this is really quite promising. What are I think, how we can harmonize evidence from different fields. Still, this is unfinished agenda. We're still learning, and this is not only for EMR, for also other regions, and how we can really consolidate the method, the tool, the knowledge, the evidence, the experiential knowledge, the data, and we can really more of support decision making. So absolutely a lot of work and progress being done, but a lot of also questions yet to be answered as we move forward. So just very briefly, I don't want to take much time. I know we have, I would love to have maybe we can spend some time, Arash, for quick Q&A, or even if the panelists would like maybe to mention, what would be that in 10 seconds, what would be that one priority that they would like to see in moving this forward in DMR? What would be that priority? And I hope we will have some time for Q&A, but over to you.
Yeah, many thanks indeed. So we have to drop the third round. So I don't think we have a chance. At the same time, I've really enjoyed listening to all of you. It's been really fascinating. These are the areas that have been better than butter for all of us over the years, but still, the level of insights shared was quite valuable. So in terms of question and answer, first of all, I'm really grateful to Mehnaz and Ahmed. So they've handled some questions already in the chat. So addressing, providing links, that's really good. I invite all the panelists to add any insights they wish to add to those as well. So let's have maybe one or two more questions if colleagues, anyone wants to ask it, and then I go to the good suggestion that Fadi had, maybe a 10-second things, and then that I will enforce for 10 seconds. So saying one thing, because we won't have time for that more than that. So any questions, participants, colleagues here? I see many familiar names, and I don't know how it works, Rasha, but I assume people can raise hand.
So Arash, we have already one question posed in the
Please
open chat from Muhammad Najib Abdullah. So he is asking.
So, yeah, please go ahead. Please read it.
Yeah. So highlighting and exploring the problem of gaps between research and policies in our region. Hope to get operational recommendations from our panelists in terms of how to explore the problem of gap between research and policies, and the recommendations need to be scrutinized by the regional office and to be translated into activities. So this is similar to another question as well that we received on how to bridge the gap between research and policy. So don't know if you would like the panelists who would like to answer this.
I guess this is also in line with what Fadi was asking about, sort of quick reflection. So I would come to the issue of the regional office part of it later on, or maybe Mehnaz can add to that, but maybe a quick round. So let's do that, given that, we've got only 10 minutes left, and I'm sure there are some final remarks that should be made. So I go maybe so I start now with the gentleman. So going with, so yes, Ahmed, you go first. So 10 seconds, what would be your?
Yes, recognizing that using evidence for policy is often challenged by sociocultural, political, time, press, public pressure factors, raising awareness among different cadres and echelons of healthcare delivery is of dire importance in using evidence for health policy making. And this is something which has to be a priority. Thank you.
Okay, thank you, Ahmed. Ali?
for me, future health scenarios. If you do this policy and you don't do it, what will happen and what will not happen? And that's very important. We realized that during COVID, put your mask, this is how many infections, how many deaths.
Thank you. Shakib?
Please, sorry. Just to highlight the collaboration. It's very, very important to exchange our experience. We see some international experience regarding collaboration. I think in our region, in our countries, we should emphasize more and more collaboration.
Thank you. Nasreen?
Thank you. I think for me, it's similar to what was just said. I think that there is so much knowledge in the region that's under-leveraged. And I think the importance of learning from each other, collaborating and using those learnings to be able to advance the right kind of decisions that are contextualized, I think should be really one of the many priorities I think that might be identified today.
Thank you. Sultana?
So two key messages for me in finding a new way to I don't know how to say it. Like now with the AI era, how to advocate for conducting a more relevant research. Second, work hardly to build on and strengthen the trust between policymakers and researchers.
Okay, very good. Mehnaz?
Thank you, Dr. Arash. I want to say that there is no one rule or factor that you can say that through that all countries they can enhance or bridge these gaps, and there are several things that can be done, which for each country they need to see and to identify what is the best for them. But I think more important that everything is, to build political commitment and national commitment, which is beyond Ministry of Health. That means, that commitment should be there in the country for using evidence for policy making, which I think that this can be one of the main factor and elements. Thank you.
And many thanks indeed. And maybe I also contribute to a similar question, and Russia brought it to my attention, that has been raised. So within the context of emergency context. So first, let's say, the colleague, I think he or she, because the name is not clear, has given example of, for example, Lebanon or I think Yemen, mentioning that. So the point is, when we talk of context of conflict, we need also to qualify, because the conflict could be chronic conflict, could be taking over time. There are issues related in the different contexts. So for example, a country affected by conflict in origin is Somalia. And in a way, so conflict has been, unfortunately, for a few decades, a fact of life. And then so lower level, higher level. But then at the same time, universities are expanding, resources are growing, and so within that context happening. So this context, in a way, the conflict becomes a sort of a confounding factor, probably not a main factor compared to many other issues, because if you can go to another country with low resources without a major conflict, and they may have similar problems if they did. When on the other hand, let's say what's happening in Lebanon right now, in an acute emergency happening into a major scale, needs decision making, but there is a strong institutional capacity already. And so, for example, the K2P Center, now we are talking to Fadi, and Russia already has started publishing certain sound bites related to the conflict and how that can be used, which is quite admirable. That's really, so the context, we need to identify what conflict we are talking, what sort of decision we are making. In a way, lessons learned during the pandemic, many of them also apply to the context of the conflict and how to use those. Two examples of recent, one older one in the pandemic, one about the conflict in Gaza, I want to highlight. So during the pandemic in Yemen, there were some strong satellite studies that were conducted to estimate mortality due to COVID in Yemen. And some of them became innovative methodologies done. And right now on Gaza situation, recently a paper was published mapping sort of the location of certain types of bomb being dropped in Gaza with their distance with the sort of hospitals, and then sort of making policy sort of decision based on that. So obviously not directly on the health outcome, but may affecting peace processes that will be the biggest factor for enhancing health outcome. So in a way, so would be very different to the context, but sort of the one issue from my point of view would be that how to say what are the minimum things that we cannot live without, identify those, and then acting within those constraints. So there won't be, unfortunately, a straight answer here either. So with that, passing to you, Rasha, for the next elements to take forward.
No, thank you, Arash. This is very, thanks for the excellent moderation, for sharing this session, for the great insights. Thanks for all the panelists. And we promise you we're going to finish on time. I think this was really quite insightful, and I don't need to add actually to the great, I would say, insights and learning we got from you today. I just wanted to mention that, this was the pre-conference, as I mentioned before, it was split into 3 plenaries. I want to remind everyone that, and I'll also ask Rasha to speak a little bit about that, what that means for Japan. But I want to also remind everyone about the insight, besides of the great insight we received or we got today from the third plenary. We got interesting insights from Plenary 1 when it comes to healthcare integration, to strengthening primary care models, to public-private partnership, to digital innovation and for data management, to empowering patient and communities when it comes to policy making, to actually making sure that UHC is being done in a sustainable way and implemented at the government priorities. And also we've learned from Plenary 1 about the importance of integrating universal health coverage and health security as well as part of that integrated agenda. We also got great insight about emergency preparedness and targeted care, particularly in conflict countries, and making sure that really vulnerable populations are served, particularly in conflict-affected areas. In Plenary 2, just to remind everyone, there were the great discussions as well when it comes to how we can make sure that, well, there was an acknowledgement in Plenary 2 that there shouldn't be a double standard at the global level when it comes to facing the ongoing crisis and conflict in the EMR. Unfortunately, we're living, and we're I was saying, paying the price for the double standard. There was a great insight that came from about regional collaboration over different approaches with a proactive planning for health systems, particularly when it comes to the impact of conflict, mass displacements, climate crisis, how we can build a multi-system resilience, across different sectors, how we can decolonize knowledge production when it comes to the context of our region, how we can strengthen advocacy. All this came in Plenary 2, in addition to climate change when it comes to how we integrate climate change in the health system. And we don't speak about them in 2 different ways. How this can be part of the thinking and reimagining of health systems, how we can adopt One Health approach that recognize the interconnectedness between a human, animal, and the environment, how we can plan for future crises, how we can have proactive planning for future crises, and what we have learned so far, and how we can really strengthen cross-border health initiative. All this are actually great insight that we have also heard. I just wanted to remind everyone about the insight we received also and heard in Plenary 1 and Plenary 2. And Rasha, you have only 2-3 minutes to end, and you just tell us what that means, all those great insight that we received over the successful pre-conference that SHG has actually organized in the region in collaboration with WHO, UNRWA, and K2P, what that means to all the discussion and deliberation that will take place in Japan. Over to you.
Thank you, Fadi. So I just want to reiterate by saying that thank you to everyone for your active participation in today's final plenary and throughout the entire pre-conference. It really has been a privilege for HSG EMR Network to host this pre-conference in partnership with K2P Center through Fadil Jardali and our partners WH Amro through Dr. Arash Rashidian and Dr. Awad Mataria, and in collaboration with the Mohammed bin Rashid School of Government through Dr. Emmanuel Munasser and the University of Birmingham in Dubai through Dr. Ayat Abu Agla. So over the 3 plenaries, we have uncovered key gaps, we have shared innovations and solutions, and we have generated a wealth of actionable ideas. But certainly our work does not end here. So the key insights and the messages from this pre-conference will be taken forward and disseminated as part of HSG EMR session that will take place at the main event in Nagasaki, Japan, during 18 to 22 November 2024. And I will be joined by my colleagues from WHO EMRO and the K2P Center, where we will have the opportunity to ensure that the unique perspectives and the challenges of the EMR will be shared with the global audience. And certainly our voices, which is the EMR voice, is heard in the international stage. And beyond the Nagasaki, we will certainly continue the conversation with all of you with the aim of translating our collective efforts into concrete actions at both regional and national levels. So we will certainly have reports and commentaries coming out and shedding light on the key insights, because our aim is to achieve impact at the end of the day. So as we move forward, let us continue to collaborate and push for health systems that prioritize just equity and sustainability. As we have heard from our panelists and moderators and keynote speaker, it's clear that we cannot wait for the next crisis to act. Now is the time to strengthen our health systems, empower stakeholders with the right data and knowledge, and institutionalize evidence-informed decision-making across the region. Once again, thank you to our partners, sponsors, collaborators, panelists, and to you, the audience, for making this pre-conference a success. I look forward to seeing many of you in Nagasaki, where our journey continues. I would like to give the stage to you, Arash, if you have any final word before we wrap up. Thank you, everyone.
Yeah, I mean, we are last second. One request from Farid from K2P team that everybody please open your camera. I think he's trying to get a photo. I think I'm helping the processes from the K2P side. Last word, I mean, not as a last word, just in terms of the process, I would say, I mean, part of the AI discussion was quite, fascinating that came in the discussion. I wanted to tell you that also tomorrow in the regional committee, as part of the ministerial program, there is a 1-hour session on AI and its use in the region, in the health sector, including a discussion on use of AI for decision-making, which was covered today. So that's
fantastic. Great. So thank you so much for everyone. This was a really great, session. We are being asked to actually open our cameras for the group photos. And Arash, I know Awad is not with us as well, but any 5 seconds final remarks from WHO EMRO in this on this.
No, it's been a pleasure working with you and across the board and with this initiative. I mean, we all had limited time, but I mean, it's been impressive, the participation. I mean, quality participation in 3 panels. So I had the pleasure of joining 2 of them. I'm very grateful to AV, very grateful to Health System Global and other partners. So I mean, in a way, so I mean, yeah, just the thank you. I think the main message at this stage.
Great. Thanks to everyone. I believe the photo was taken. Thank you so much for all your time. Sorry if we took 2 minutes extra time from what we already planned for. Thank you so much for the great contribution.
Thank you so much.
Bye-bye.